Hi there, my name is Gerard Green. I'm a men's health athletic pelvic physiotherapist here in Birmingham at the Physio clinic at Barefoot Yoga. And this is a short video that we've done mainly for GB gymnastics and trampolining, and also for the English Institute of Sport, on what we do in the clinic for elite female pelvic health dysfunction. And just a really big thanks to Lou and Jason at GB Gymnastics for spending some time with us to really give us an insight into what their athletes do. And it's been great to work with them. So first of all, I'm going to ask Lisa a couple of questions, and then we're going to really go and look at her doing some abdominal ultrasound, because this is the way that Lisa and her female physio colleagues tend to look at the pelvic floor now, which is really good. So Lisa, first of all, what do the elite female athletes tend to present with from a pelvic floor point of view?
A lot of the elite athletes tend to present with overactivity in their pelvic floor.
Okay.
So rather than weakness, a tightness in the muscles. Without realising it, they can be gripping on with their pelvic floor muscles.
So they're almost doing too much. Those muscles are doing too much.
And the problem is, with a muscle that's gripping on too much for too long, fatigue sets in, so it can get very tired.
And what type of symptoms should these female athletes be looking out for, or what should their maybe coaches or their elite sports physios be looking out for?
Symptoms can be quite varied, but certainly any elements of pelvic pain.
Okay.
Any dysfunction in emptying bladder, so any changes in the flow of urine.
And maybe a little bit of urinary leakage?
Yeah, so we talked about the fatigue element if the muscles are overactive. So if a muscle's very tired, it can't then do what you want it to do when you want it to do it. So sometimes you can have what we call stress urinary incontinence, which is leakage of urine on activity, and that might be when you're stretching or actually training or doing the sport itself.
So do you also see some of the female athletes also get maybe problems maybe in controlling wind as well? It seems to be a common symptom.
Absolutely. So we've got to remember that the pelvic floor muscles go right from the back passage all the way through to the front and control the bladder and the bowel. And if you have some problems with dysfunction of the pelvic floor muscles, it might be that you can't completely control the passage of wind.
Okay, I think what we'll do next, Elisa, is go into one of the treatment rooms and have a look at what kind of magic you do there and how you look at the pelvic floor, especially with this ultrasound imaging, which I think the athletes will be used to, because they'll probably have maybe their shoulders looked at or their kind of Achilles tendon. So it's a bit like that. So here in one of our treatment rooms, we've got Georgina. Hi, Georgina.
Thank you, Georgina.
So Lisa, we'll hand over to you. So Lisa is going to look at Georgina's pelvic floor using our ultrasound scanner. So you just ignore me, Lisa.
This is the machine that we use, and Georgina is going to do this in standing today, and it's non-invasive. We are not doing anything invasive today. We are using a probe with some gel on. We're going to pop it on the top of Georgina's tummy, and we're going to be able to see down towards Georgina's bladder, which is tucked under the pubic bone here at the front.
Okay.
And underneath, we should be able to see the pelvic floor muscles.
Brilliant,
So
brilliant.
So all you should feel, George, is some pressure from the probe. It's not uncomfortable, it's not heat, it's not painful, okay? But it will be a little bit of pushing. Alright, so we'll pop that on there. And we have to look down behind the pubic bone.
So what are we seeing there, Lisa? What's that big shape there?
So on the screen you can see light and dark. The black area, the round or squarish area, is the bladder.
Okay.
And the black inside it is fluid, so that's urine in the bladder. If you look slightly underneath where you've got the white linear aspect.
So like the line.
Yeah, the line's going across horizontally.
Okay. And what would you get Georgina to do then when the probe is in place? Looks quite comfortable there, Georgina.
Yeah. What I'm going to ask Georgina to do is to work her pelvic floor. So if you think about the muscles around your back passage and try and gently tighten them as if you were trying to stop yourself passing wind, and relax them down again. And you might be able to see a lift of this white bit here. Do that again for us, George. Up and release.
Oh,
and
yeah. So can we do a few of those maybe? So we just...
So keep your eyes on the white
Okay, so that's a nice lift.
And relax.
And maybe another couple. Up and then down.
Lovely.
Brilliant.
And you keep breathing throughout this. You don't hold your breath. You relax your tummy, and all that is working is your pelvic floor.
So is this a nice way, Lisa, of finding out, is this pelvic floor doing too little? Or maybe, as you said outside, is it doing too much?
Exactly. So we can see if the muscle can shorten and contract,
Okay.
and lengthen and relax. And with an overactive pelvic floor, which is clearly not Georgina, you wouldn't see that relax, you wouldn't see that drop.
And I suppose what's quite interesting for me is that it looks like you can also do the look at what the pelvic floor is doing in, it looks like in standing here, or maybe in squatting, or in loads of different positions.
So you can do this in lying, you can do it in sitting, you can do it in standing. You can look at it functionally. So if there's a particular movement that causes some problems with the pelvic floor leakage, then you can do the ultrasound during that activity.
Brilliant.
And see what happens.
And then as you're kind of holding the probe there, and Georgina looks like she's doing loads of really nice things with that pelvic floor. It looks kind of moving again, which...
Can we do some quick flicks, George? So can we go squeeze, release, squeeze, release, squeeze, release, squeeze. And you can see that sort of pulsing action. And what we're doing there is getting her to work her fast twitch muscle fibres. And these are the ones that are vital for continence and control of urine.
And then I suppose another couple of questions that the athletes and probably the coaches and elite sports physios will want to know, Lisa, is, so apart from the ultrasound and apart from asking all the questions to the athletes, you also do a lot, you also look at their lumbar spine and hips, is that right?
Yeah. Absolutely. So it's not just about the ultrasound. Externally, there's an awful lot we can look at in terms of the back, posture, lumbar spine, abdominal muscles and tone here, the hips, etc.
And do lots on breathing as well.
Breathing's key. So we'll always look at the breathing mechanics, particularly the diaphragm muscle which sits under the ribs here, because that diaphragm muscle has to work with the pelvic floor. And if we get that breathing right, we can often get the pelvic floor dynamics right as well.
And you mentioned outside in the reception that some of these athletes might have some urinary symptoms. They might be maybe have an overactive bladder, so they're going to the loo all the time, or they might have some bowel symptoms. So do you also give the athletes a lot of advice on how they can kind of almost retrain that bladder and bowel?
Yes. We would give them bladder retraining, which might involve interval visits to the toilet, timed voiding schedules, depending on the symptoms. It might involve correct voiding positions, breathing patterns, so that we're not straining on the toilet to empty, we're not forcing.
So lots of really detailed specialist advice and education.
Exactly.
And so I think from what you've spoken about and what you've talked a little bit about the spine, the hips, looking at the breathing, probably look at the abdominal muscles, you've done some ultrasound scanning. So this is beginning to look a bit more like sports physiotherapy, is it? Even though we're pelvic floor specialists, but this is very much like the sports physio that the athletes will probably have had before for a shoulder problem or a hip problem.
Exactly. I'm sure a lot of the athletes have had some kind of ultrasound on it, maybe their arm or another part of their body. This is very similar. We are looking at muscles that are not functioning correctly, and although it's a different area, we do need to address it in order to gain sort of the best performance.
Brilliant. And I think as well then, there's a lot of myths out there about that pelvic floor physiotherapy is lots of internal work, which I think is can be a bit off-putting for a lot of the female athletes. So it looks now that am I correct that with a lot of the athletes you probably don't do any internal, you probably do more the ultrasound and leave it for a small number?
Yeah, in fact, it's quite rare that we do need to do an internal vaginal examination. With the majority of people, we can work externally on the breathing mechanics, lumbar spine, abdominal with real-time ultrasound and treat those sort of problems completely, effectively.
Brilliant. And I suppose maybe to finish now, I suppose it'd be good to make the point that we know that with lots of the athletes that urinary symptoms are very common, but I suppose we need to just get that message across that it may be very common, but it's not normal.
No.
It indicates a problem. Would you like to kind of say anything to finish on that, Lisa?
Yeah, I think you're absolutely right. It is very common, but it's not normal. Not once. A leakage is never normal. So even if it's only on the odd occasion or it doesn't happen every time, it's still not okay. It still means there is a problem there that needs addressing, and it can be treated quite easily. And so just like any other problem you would have throughout the body, this has treatment that's effective, and we can resolve these issues. You've just got to start talking about it,
Exactly.
be open about it, and just making it a very normal thing to discuss and get treatment for, like you would any other condition.
That's brilliant. So on behalf of me, Jared, I'd like to thank you, Lisa, for really giving us a really detailed insight into what you do with the female elites and what the other pelvic health physios here in the clinic do. I'd like to thank Georgina for being an excellent model for the ultrasound. So well done on that. Well done on that. Some great pelvic floor work there. And on behalf of me, Jared, a big thank you to those who have spent time to watch the video, and I hope you've found it useful. And you'll find lots more information on the website, particularly around the elite athletic pelvic floor work we do at www.hormonephysio.co.uk. And many thanks for watching.